Hello friends, welcome back to my channel once again with another new topic. So today we are going to discuss your practice MCQs of biochemistry part 5 and the MCQs are from the topic enzymes, that is enzymology. So hope you are liking my part 1, 2, 3 and 4 MCQs. So before starting the video, I would like to request you to please like, share and subscribe to my channel. Keep supporting me and let's get started with our today's video. So friends, our 61st question is amylase is secreted by the option A pancreas and salivary gland, option B small intestine, option C large intestine and option D kidney. So friends, as you all know that amylase is also a kind of enzyme. So they are asking that it is secreted by which gland in our body. So the right answer is answer A, that is pancreas and salivary glands. They both secrete the enzyme called amylase. Okay friends, moving on to our 62nd question. What is the normal reference range for lipase? Just now we have discussed about amylase. Here they are asking about the normal reference range for lipase. Option A 190 unit per liter. Option B 250 unit per liter, option C 80 unit per liter and option D 300 unit per liter. So friends, the right answer for the normal reference range of the lipase is option A, that is 190 units per liter. Next, moving on to our 63rd question. Lipase is a pancreatic enzyme that changes fats and triglycerides into option A fatty acids, option B glycerol, option C both A and B and option D none. So the right answer is option C both A and B. That is here the lipase is a pancreatic enzyme which can changes fats and triglycerides into what? Both fatty acids and also into glycerol. So the answer is answer C both A and B. Okay friends. Next, moving on to our 64th question. Request for the analysis of serum acid phosphatase is often done in male patients with suspected option A prostatic cancer, option B kidney failure, option C hypothyroidism and option D malnutrition. So the right answer is answer A, that is prostatic cancer. Moving on to our 65th question. Acid phosphatase, that is ACP, is an enzyme of the hydrolase class of enzyme and acts in an option A acidic medium, option B alkaline medium, option C neutral medium and option D none. So the right answer is option A, that is acidic medium. Okay friends, moving on to our 66th question. Increased levels of prostatic fraction are associated with option A prostatic carcinomas, option B hyperparathyroidism, option C liver diseases and option D Page's diseases. So the right answer is here the prostatic fraction, if it is increased, then it is associated with prostatic carcinomas, that is prostatic cancers. Okay friends, moving on to our 67th question. What is the normal reference values of SGOT? Okay friends, the normal value of SGOT. Option A 80 to 40 units per ml, option B 0 to 60 units per ml and option C 20 to 80 units per ml and option D 80 to 160 units per ml. So the right normal reference value of SGOT is option A, that is 8 to 40 units per ml. Okay friends, moving on to our 68th question. SGPT is found in a variety of tissues but is mainly found in option A liver, option B kidney, option C lungs and option D all. So the right answer is SGPT is found in a variety of tissues but mainly it is found in liver. Okay friends, so moving on to our next question, 69th question. Creatine kinase is mainly found in option A muscle, option B brain tissue, option C both A and B and option D none. So the right answer is answer C both A and B. So the creatine kinase is found mainly in both A and B, that is muscle and brain tissue. Okay friends, moving on to our 78th question. The most specific enzyme test for acute pancreatitis is option A acid phosphatase, option B trypsin, option C amylase and option D lipase. So the right answer is answer C amylase. So acute pancreatitis is associated with amylase. If the amylase normal range increases, then it can cause acute pancreatitis. So it is associated with acute pancreatitis. So the right answer is option C, amylase is the right answer. Moving on to our next question. Which of the following enzymes are used in the diagnosis of acute pancreatitis? Option A, amylase and lipase. Option B, aspartate aminotransferase, that is AST, and alanine aminotransferase, that is ALT. Option C, 5-nucleotidase, that and gamma glutamyl transferase, that is GGT. Option T, aspartate aminotransferase AST, and lactate dehydrogenase LD. So here what they are asking, which of the following enzymes are used in the for acute pancreatitis? What are the enzymes will go with the diagnosis? So the right answer is answer A, that is amylase, that is AMS, and lipase. These two are associated with acute pancreatitis. Okay friends, moving on to our 72nd question. A physician suspected his patient has pancreatitis. Which test would be most indicative of this disease? So option A, creatinine. Option B, LD isoenzymes. Option C, beta hydroxybutyrate, and option D, amylase. So friends, just now we are discussing regarding amylase and lipase more in our questions. So the same question is asking in a twisted way. So don't get confused with these type of questions. The question is simple, but sometimes we get confused with this type of questions. Here the the patient is having pancreatitis. So that's just now we have discussed that the pancreatitis is associated with amylase itself, right? So don't get confused. Here the options are option A, creatinine. Option B, LD isoenzymes. Option C, beta hydroxybutyrate, and option D, amylase. So option D, amylase, is the right answer, as it is associated with acute pancreatitis. Okay friends, moving on to our next question. Aspartate aminotransferase, that is AST, is characteristically elevated in diseases of what? Option A, liver. Option B, kidney. Option C, intestine, and option D, pancreas. So the right answer is answer A, liver. Okay, AST will be elevated in the diseases of mostly in the liver. Next, moving on to our next question. Aspartate aminotransferase, that is AST, and alanine aminotransferase, that is ALT, are both elevated in which of the following conditions? So AST and ALT will be elevated in which conditions? Option A, muscular dystrophy. Option B, viral hepatitis. Option C, pulmonary emboli, and option D, infectious mononucleosis. So the right answer is option B, in viral hepatitis. Both AST and ALT, otherwise called as SGPT and SGOT, they both will be elevated. Okay friends, moving on to our 65th question. Given the following results, here is a kind of case history with this lab report. Alkaline phosphatase is slightly increased, aspartate aminotransferase is marked increase, alanine aminotransferase is also marked increase, and gamma glutamyl transferase is slightly increased. So this is most consistent with option A, acute hepatitis. Option B, chronic hepatitis. Option C, obstructive jaundice, and option D, liver hemangioma. So the right answer is here they are asking about that AST and ALT both are markedly increased. So just now we have discussed that AST and ALT will always be elevated in the high risk of the diseases related to liver. So the right answer is option A, acute hepatitis. Okay friends. Next, moving on to our next question. Which of the following clinical disorders is associated with the greatest elevation of lactate dehydrogenase isoenzyme, that is LD isoenzyme? Option A, pneumonia. Option B, glomerulonephritis. Option C, pancreatitis, and option D, pernicious anemia. So this elevated level of lactate dehydrogenase isoenzyme LD is always associated with option D, that is pernicious anemia. Okay friends, moving on to our next question. The enzyme which exists chiefly in skeletal muscle, heart, and brain is grossly elevated in active muscular dystrophy and rises early in myocardial infarction is Option A lipase, option B transaminase, option C lactate dehydrogenase, and option D creatine kinase. So the right answer is option D creatine kinase. Moving on to our next question. When myocardial infarction occurs, the first enzyme to become elevated is option A CK, that is creatine kinase, option B LD, that is lactate dehydrogenase, option C AST, and option D ALT. So the right answer, when the myocardial infarction occur, the first enzyme to be get elevated is option A, that is creatine kinase, which is also called as CK in a short form. Okay friends. Moving on to our next question. A 10-year-old child was admitted to pediatrics with an initial diagnosis of skeletal muscle disease. The best confirmatory test would be, so it is a kind of case history question, just a twisting question. So the what they are asking, that a 10-year-old child was admitted to pediatrics in an initial diagnosis of what skeletal muscle diseases. So what would be the best confirmatory test? Option A creatine kinase and isocitrate dehydrogenase. Option B gamma glutamyl transferase and alkaline phosphatase. Option C aldolase and creatine kinase. Option D lactate dehydrogenase and malate dehydrogenase. So the right answer is answer C, option C, that is aldolase and creatine kinase may be the best confirmatory test. Okay friends, moving on to our next question. The protein portion of an enzyme complex is called as option A apoenzyme, option B coenzyme, option C holoenzyme, and option D proenzyme. So the right answer is option A apoenzyme is the right answer. So friends, these are your practice MCQs, some of the practice MCQs from the topic enzymes. Hope you like it. So please like, share and subscribe to my channel. Keep supporting me. See you in the next video. Thank you friends.